Carol, thank you, and thank you all for coming. Some of you are stalwarts and are here for the third conference that we've had. Others are new today, and we thank you for coming and sharing your views. And we're trying to hear from the field as much as we can and hear from the experts. And I know today we had a great session. I was not able to be here for all of it because we're in session today and doing fun things like voting 20 times for the same judge or whatever we did today. But there are some important things we should be getting done, and one is passing some legislation here at the federal level to help implement some of the good ideas that you all have been giving us. So, Carol, thanks for what you do with Faces and Voices of Recovery and helping to put together a great group of experts today. I understand we've heard from some medical experts just about addiction, too, which I think is really important to get back to the basics here, which is treating addiction like other diseases, understanding that that involves prevention, and I saw Art Dean here earlier, and he's done some great job with the community coalitions, and we do have that federal legislation we need to get reauthorized that I was the author of 20 years ago on community coalitions and prevention. Coalitions also get involved now more in treatment, as you know, including ours in Cincinnati that we're working on. But that's important, but early intervention, just as you would with heart disease or diabetes, and then, of course, recovery. And I think that's part of the mindset change that needs to happen. I appreciate Bill and Margot being here today. I just mentioned I didn't hear their story, but I heard about their story. And the fact that you are channeling your grief and honoring the memory of William through trying to get some better things done here in Washington and then much more importantly at the local level and the state level is very much appreciated. And I imagine that's hard, and we thank you for being here. To the question about the federal prison system and some of the lapses or lack of focus on some of the medical assisted treatment, there's probably more that can be done in the draft legislation we have, but I hope you'll take a look at the bill that Senator Whitehouse and I have introduced. It's called the Recidivism Reduction Act, and it focuses on the federal prison system. So it's building on the Second Chance Act, kind of backing it up into the federal system. And if you don't mind, Megan, who is here in the back, will get you some material on that if you don't already have it, and maybe give us some input on that legislation. It was introduced, but it has not yet come to the floor. And then we've also, of course, got in CARA, this broader bill. CARA also has some provisions on the federal prison system, some of which are taken from the more specific bill that Senator Whitehouse and I had introduced. So I do think there's some ways at the federal level we can use the federal prison system to be at the cutting edge rather than be lagging what some of the states are doing that's working and that's very innovative. And along those lines, Gary, thank you for coming again and all your work back home. And we usually meet in prison, so this is unusual for us to be here in a conference room. But I think Ohio's doing a really good job. They have taken full advantage, by the way, of the legislation called Second Chance in Ohio, and that's good. A lot of the federal grants have been effective, I think you would say, Gary. I think your recidivism rate is now double-digit reductions, and it's the same between a lot of your states, Texas, Michigan, other states. But we encourage you to keep using that opportunity, and that's another bill that we have a reauthorization that's gotten out of the Judiciary Committee already on, and we would hope that folks would help us to get that through the process as well. I think it's an improved bill from current law, and it will help us to keep the appropriations level by having an authorization. Otherwise, the authorizations lapse, and the appropriators, they're not in the room here, right, so I can say this. The appropriators say, well, why should we be appropriating at these high levels when we don't have an authorization? So it does help us to get an authorization, and this one, again, I think it streamlines the bill in ways that are helpful, picks up some of the best practices, some of the more innovative things that are going on that otherwise, wouldn't be part of a bill that was written 10 years ago. And so I hope you'll help us with that as well. On CARA, I'm excited to learn, and maybe you've already talked about this today, that Congressman Sensenbrenner and I think several Democrats are introducing a bipartisan companion bill to CARA in the House. And has that already been introduced? Does anybody tell me? But it hasn't been introduced yet, so that'll give you another project if you're interested. It's just to contact your members over there and to say, look, here's a broad look at addiction, not just at heroin, by the way. We think this should apply to to, other issues that will come up in the future, because once we sort of tamp down one drug use or even epidemic in the case of Ohio and heroin and our overdoses, then another one tends to crop up. And we saw this in the 90s with cocaine. We're seeing it now with heroin. We saw it with other drugs as well. So, but we hope you will help us with that. The bottom line is that once again, we've gotten a lot of good information here today, and we thank you for that. And to get better science, to get better information as to what's working and what's not working is absolutely critical to us putting together good legislation here. Ultimately, this is not going to be solved in Washington. It's going to be solved in our communities. But I know Washington can help. I've seen it with the Drug-Free Communities Act and with the Second Chance Act, and we want to continue to play a positive role to help break this cycle of recidivism and the grip of addiction. And we think there's a really great opportunity to build on our success and do a lot more. So thank you for coming. Thank you for listening. Thank you for the input so many of you have given. And I hope that you will be willing to engage on the specific legislative initiatives that we've begun. And many of you were part of drafting CARA. If there are things you think we should improve on it, let us know on that too, because we now have the opportunity. We'll have to, in a new Congress, reintroduce it and have another process. And we are dedicated, and I speak on behalf of the Republicans and the Democrats, Senator Whitehouse, Senator Ayotte, and others who came here today, but also others who are now recognizing in their own states that this issue is one that has to be addressed, it has to be confronted, and if it's not, you continue to see so many people not be able to achieve their God-given abilities, and our communities bear the cost. So thank you for being here and what you're doing in the trenches every day. God bless.